So how do we prepare for the high costs of getting older? The first thing you want to consider is the care itself. What type of care might you need and how much might that cost? Some of our statistics, the odds that a person will need some skilled nursing home care. Now, this is not assisted living or in-home care. This is actual nursing home care. In his or her life, for persons over the age of 65, 43% of those individuals will need some time in a nursing home. The average stay is almost 2.5 years, and 55% of those who do go into the nursing home end up being there for more than a year. So what does it cost to be in the nursing home? You can see here on our chart, we've got a number of different levels of care, and we've got the cost spelled out for each of those. So for the nursing home level, that is your highest level. When we say skilled care, that means you are getting nurses, you're getting doctors, you're getting that skilled level of professional medical care. It's $7,500 to $12,000 every month. That depends on your market, and it also depends on what services are you actually getting while you're in there. The more therapies and other services that you receive, the higher the monthly cost will be. For assisted living facilities, we see that that's about $2,500 to $5,000 per month. Personal care is a level of care that's between the assisted living facility and the nursing home. Not every state has this. Indiana does not. Kentucky does. It's where in Kentucky you'll get your first level of true medical care with nurses actually being there and providing medical care. So that's $5,000 to $7,000 per month. And then if you're receiving in-home care, you may not need 24-hour, 7-day-a-week care, but you may just need 3 hours a day, 4 days a week, something like that. That's going to be billed on an hourly basis, generally, if we're talking about from a medical or non-medical type of care agency. And those care costs generally would range from $15 an hour to $25 an hour. Now, there are some hidden costs that we haven't yet discussed, and those are the costs that our adult children, our other family members, even our friends might have to bear in order to be caregivers for us. Those are extraordinarily high. They may give up their own jobs, their own family time. Some of it is monetary, some of it is not, but a high cost indeed. So as we get older and we start to plan for our care, there's so many questions, there's so many issues that come up, and so many times we see that people just don't know how to arrange all of these in a way that makes sense from them. You've got different pieces, certain things you don't even know what to ask, or you don't know about your legal documents. You don't know if they're good enough to get you the type of care that you're going to need. How much is it going to cost? One way to put all of these pieces in order and to make some sense of the care spectrum that we see people on is to participate in life care planning. That's the type of service that we provide. We are a life care planning law firm, and that's where all of those jumbled pieces start to come together so that you find a way to pay for your long-term care and you find out what level of long-term care that you need. You try to preserve those assets so that you don't lose your life savings in order to pay for your care. You make sure that if you have long-term care insurance, those claims can get handled properly, and just start to make sense of all of the care planning needs. When you do life care planning, some of the goals that we're going to help you meet would be, number one, first and foremost, to actually have a plan in place. You would have a plan that you would be following to know that if something comes down the road that is at a different level where you might be right now, you're gonna know how to take care of that. We obviously want you to stay home as long as possible and receive care where you are most comfortable receiving it. We want your care to be quality care. Sometimes that does mean receiving care from professionals rather than just friends and family. If you're concerned about depleting your assets and you want to be able to leave a financial legacy for your family or for charities that you might want to benefit, then you're going to want to access some benefits to help pay for your care. That would be veterans benefits. It would also be Medicaid benefits. And we'll talk about at what level does each of those systems pay for care and how much would they pay. We want to help you transition through those different levels of care that we just went through. Have a smooth transition through those so that it's not disruptive, or it's as little disruptive as possible. We want to help you bring an understanding of that medical information that the care providers are giving you and are giving your family members. So many times we don't understand the lingo that they're using, the medical terminology. With our elder care professionals that we have who are involved with our life care planning, they coordinate the care for you and they serve as a liaison. Our elder care coordinators serve as a liaison to help you understand what those medical professionals are telling you about your care. And they'll also provide resources if you're in a health crisis. Sometimes something comes up and we don't know where to turn. Our elder care coordinators are that place to turn.